Welcome to the Mayo Clinic Rochester downtown campus. This campus is home to most of our outpatient practice, including the Department of Medicine Primary Care Clinic. You are facing the Mayo and Gonda buildings, which house several of our subspecialty clinics that residents will rotate through during all 3 years of training. To your left, you'll see the historic Plummer Building, which has a vast medical library and study spaces, and the Siebens Building, which is home to the Internal Medicine Residency Administration. We are now inside the Gonda Building lobby. You can see several sculptures throughout the lobby, including Man in Freedom on the south wall. There is usually a volunteer, or sometimes even a patient or family member, playing the grand piano at the subway level. Most importantly, the subway level also houses a Starbucks coffee shop and the David Geffen Auditorium, where we invite all the speakers for the Department of Medicine Grand Rounds, which is broadcast to all locations across campus. Additionally, all residents on outpatient rotations attend a weekly primary care journal club in the 12th floor auditorium. Welcome to the Baldwin Building. This is home to the Department of Medicine Primary Care Clinic. Our residents are the primary physicians for nearly 14,000 patients in the Rochester area. Each resident is responsible for their own panel of primary care patients throughout their training, which allows them to build longitudinal patient-physician relationships. The newly remodeled main floor houses the Baldwin Pharmacy and lab services for ease of access to our patients. The main floor is also home to several integrated community health subspecialists who are available for curbside consults, including cardiology, orthopedics, neurology, and dermatology, to name a few. The main floor has several conference rooms that are used for ambulatory morning report and geriatrics conferences. You are standing in the room typically used for our morning report, which is attended by all the residents on their primary care rotations and several primary care faculty. All of our didactics are currently virtual, but we look forward to resuming in-person didactics in the future. This is the resident workroom. The numbered workstations around the edges are for our residents, and the center table has several workstations for the supervising attending physicians. There are 2 cubicles for attending physicians to observe patient encounters and provide direct feedback after an encounter. This is helpful if you're looking for specific feedback on a physical exam skill or a communicating style. Attending physicians are also available to help with procedures, including cryotherapy, INDs, and joint injections. Procedures can be done within your own continuity clinic or within our fully functional procedure clinic on the same floor. You will rotate in this procedure clinic as a first year and have dedicated clinic slots for procedures as a third-year resident. Our residents are supported by an outstanding team of nurses and administrative staff. Through the glass panels, you will see several workstations for our nursing team, scheduling assistants, and medical secretaries. Each resident is assigned a medical secretary for their 3 years of training to help with routing communications to patients and obtaining records from outside facilities. Your patients will be roomed in one of these 2 hallways, and the lights will indicate which rooms are ready with your patients. The hallways also have an incredible amount of patient education materials, ranging from blood glucose diaries to hypertension pamphlets, and even digital videos on weight loss and nutrition. These are great resources to bring with you to your visit. This is one of our clinic rooms. The patient table has been updated to a fully automated chair to assist with optimal positioning. The room is also equipped with a private changing area for patients, an adjustable lamp for procedures, and all the materials needed for sample collection during your visit. If your patient needs anything from a vaccine to a sling or splint, you can complete one of the blue forms by the workstation and ask for help from your rooming staff. If the patient would benefit from a consultation with social work, pharmacy, or a chronic disease management RN, they are available on the same floor and can often see your patients on the same day. After the visit, the desk operations specialist will help you coordinate any follow-up tests and consultations. That concludes our tour of the Mayo Clinic Rochester downtown campus. Thank you for joining us.